All right, let's dive into this 46XY DSD thing. You guys sent us a research paper titled Diagnostic Approach in 46XY DSD, an Endocrine Society of Bengal ESB consensus statement.
It's a long one.
It is, it is.
But basically, we're going to unpack this condition. Someone has XY chromosomes, and those are typically associated with male development.
Right.
But the development doesn't quite follow that typical path.
Yeah.
And what's really interesting about this paper is that it's a consensus statement. So a bunch of different endocrinologists from the Endocrine Society of Bengal got together and sort of agreed on these guidelines.
Oh, cool.
So it's like their combined wisdom on how to diagnose 46XY DSD.
That's awesome.
Especially in places where they might not have all the fancy equipment and resources.
Yeah, that's a really good point, especially when you think about how tricky diagnosing DSD can be in the first place.
Right.
It's like detective work.
Exactly.
You got to gather all these clues to piece it together.
It's like a puzzle.
Yeah.
What's actually going on?
And this paper gives clinicians a roadmap for that detective work.
Yeah, so before we get into like the how-to of diagnosis, can you just remind us what DSD is?
Yes, so disorders of sex development, or DSDs, happen when there's a mismatch between someone's chromosomes, their gonads, like their testes or ovaries, and their physical sex characteristics.
Right.
So, for example, someone might have XY chromosomes, but their genitals might not look typically male.
Got it.
And it's important to remember that DSD is not just one thing. It's a whole spectrum of conditions.
Yeah, there are so many.
Yeah.
And they're all different.
Right.
Within 46XY DSD.
Right.
There are a bunch of reasons why this atypical development might occur.
Yeah, so the paper breaks it down into 4 main categories.
Okay.
So there are problems with how the gonads develop.
Okay.
Issues with how the body makes androgens, like testosterone.
Okay.
Problems with how the body responds to androgens, like an androgen insensitivity syndrome, or AIS.
And issues with the anti-Mullerian hormone, or AMH.
It's like even though we think of sex development as this kind of straightforward thing,
right,
there are all these different points in the process where things can go differently.
Exactly.
Leading to 46XY DSD.
Precisely. And the paper really emphasizes how crucial early diagnosis is.
Okay.
So the sooner we understand what's going on, the better equipped we are to make decisions about things like sex assignment,
right,
potential health issues, and long-term care.
Right. So let's dive into that diagnostic process. It's like a step-by-step guide. It's laid out in the paper.
Yeah.
Where do we even begin?
Well, it all starts with a really thorough medical history.
Okay.
Including family history.
So more than just what brings you in today.
Oh, absolutely. We're talking about really digging deep. For example, if the parents are blood relatives, that increases the chance of certain genetic conditions that can lead to DSD.
Oh, wow.
And if there's a family history of similar conditions, that could point to a specific inheritance pattern like AIS, which is linked to the X chromosome.
Right. Makes sense.
The paper also mentioned looking for certain things in the baby's history, like trouble thriving, recurrent vomiting, or needing glucocorticoids.
Why is that significant?
Good catch. Those can be signs of a condition called primary adrenocortical insufficiency, or PAI.
PAI.
Yeah. Which can sometimes be linked to certain types of 46XY DSD.
Okay.
So it's like a little red flag
right,
that might point us in this specific direction.
Got it. So we've got the history.
Yeah.
Now we got to do the physical exam, right?
Exactly. This is where we carefully examine the genitals to get a clear picture of what's going on.
Okay.
Things like the position of the gonads, the size of the phallus, and how the labioscrotal folds have developed, all important.
So this is where a clinician's experience really comes into play, being able to spot those subtle differences.
Absolutely. The paper even mentions a phenomenon called penoscrotal transposition, where the scrotal folds extend above the base of the phallus.
Wow.
It's not that common.
Okay.
But it could suggest a non-hormonal cause for the DSD.
Right.
What we call a malformative DSD.
Got it.
So it's a clue that the issue isn't primarily with the hormones.
Okay.
Right.
They also talk about measuring anogenital distances, or AGDs.
Yeah, AGD.
Those are specific measurements, right?
AGDs can give us insight into how much androgen exposure there was during fetal development.
Okay.
Think of it like a measuring stick for the impact of those hormones.
So we're building this picture of the physical presentation,
Right.
but the paper stressed that it's not just about the genitals.
Yeah.
It recommends a full systemic examination, looking for any abnormalities beyond the genitals.
Yes.
Why is that so important?
Because sometimes those seemingly unrelated features can be like breadcrumbs,
Okay.
leading us to the root cause of the DSD. For example, a Wilms tumor, which is a type of kidney cancer,
Okay.
can sometimes be seen in patients with a specific type of testicular dysgenesis.
Oh, wow.
Or certain skeletal abnormalities might be a sign of POR deficiency, which affects how the body makes steroid hormones.
Okay.
So these extragenital findings can be incredibly valuable clues.
That's fascinating how seemingly unrelated things can be connected in the body.
Absolutely. The body is a complex and interconnected system.
So we've gathered all this information, the history, the physical findings, even these potential clues from other parts of the body.
Right.
What happens next?
Well, if the clinical exam suggests a DSD, the next step is karyotyping.
Karyotyping.
Yeah, this means analyzing the chromosomes to confirm the presence of the Y chromosome
Okay.
and rule out any chromosomal abnormalities. It's like double-checking the blueprint to make
Yeah.
sure we're working with the right set of instructions.
So karyotyping is like the foundation for further investigation.
Exactly. And then, depending on the results of the karyotype and the initial assessment, we might move on to hormonal evaluation.
Hormonal evaluation.
This is where things get really interesting because we're looking at the body's chemical messengers, the hormones, to see if they're playing a role in the DSD.
So we're going even deeper beyond the physical presentation, and now we're in the realm of hormones.
Exactly.
Okay.
But keep in mind that choosing which hormone tests to do really depends on the patient's age.
Okay.
And just as importantly, the results have to be interpreted based on what's considered normal for that particular age group.
Right, right.
Hormone levels change a lot throughout life, so what's normal for a newborn might be completely different for a teenager.
Right, it's all about context.
Exactly.
So what kind of hormone tests are we talking about?
One of the key tests is the HCG stimulation test.
HCG.
Yeah, it's basically a way to check if the Leydig cells in the testes are working properly.
Okay.
These cells are responsible for producing testosterone.
Mm-hmm.
So we give them a little nudge with HCG, which is a hormone similar to LH, and we see how they respond.
So it's like we're giving the testes a little test drive.
Exactly.
Yeah.
We can see how well they rev up their testosterone production.
Got it.
And there are different ways to do this test,
Yeah.
depending on the patient's age and what we suspect might be going on. Sometimes a 72-hour test is enough, but other times we might need a longer test that goes on for several weeks.
Oh, wow.
Yeah.
What other hormone levels are important?
Well, AMH, or anti-Mullerian hormone, is another one that can be helpful.
AMH.
If AMH levels are low, it could be a sign that the testes haven't developed properly, which is called testicular dysgenesis.
Okay.
On the other hand, if AMH levels are high in someone who's nearing puberty, it might suggest AIS or 5R2D,
Right.
which are conditions that affect how the body responds to testosterone.
So it sounds like AMH can give us some clues about how well the testes are functioning
Exactly.
overall.
And by looking at the ratios of different hormones after the HCG stimulation test,
Okay.
like the ratio of testosterone to delta-4-androstenedione, or the T4A ratio,
P4A.
or the ratio of testosterone to dihydrotestosterone, or the TDHT ratio,
Okay.
clinicians can get a better idea of whether there might be a problem with specific enzymes involved in hormone production.
Wait, slow down. That's a lot of technical terms.
It is.
Can you just break down what those ratios mean
Yeah,
and why they're important?
you're right. It can get a bit jargony.
Yeah.
Basically, those ratios help us pinpoint potential enzyme deficiencies.
Okay.
If the T4A ratio is low after the HCG stimulation,
Yeah.
it's a strong indicator of a deficiency in a specific enzyme called 17-HSD3.
Okay. Got it.
And a high TDHT ratio might suggest a deficiency in another enzyme called 5-reductase type 2.
Got it.
These deficiencies can disrupt the normal production of testosterone
Right.
and other hormones.
Which can lead to DSD.
Exactly.
Okay. That makes more sense.
Good.
So it's like we're using this chemical equation to solve for the missing variable
Yeah,
in the hormone production process.
exactly.
You got it. And while the The gold standard for measuring these hormones is a technique called LC-MSMS.
Right.
The paper acknowledges that this might not be available everywhere,
Yeah.
especially in resource-limited settings.
Yeah.
So they reassure clinicians that immunoassays, which are more widely available, can be used as an alternative as long as they're aware of the limitations.
Exactly.
So even in areas without the fancy equipment, they can still get a pretty good idea of what's going on.
That's the idea.
Okay.
It's about making the most of the resources that are available.
Right.
But it's important to remember that all these hormonal tests need to be interpreted in the context of the patient's clinical presentation and age.
Right.
It's not just about the numbers, it's about understanding the whole picture.
So we've talked about the history, we've talked about the physical exam, and now we've talked about the hormonal evaluation.
Right.
What's next?
Well, we also need to get a look at the internal anatomy,
Okay.
which means using imaging techniques. The paper recommends that all patients with 46XY-DSD undergo an abdominal and pelvic ultrasound.
Okay.
It's a safe and painless way to see what's going on inside.
Yeah.
And it can be really helpful for identifying certain structures, like the Müllerian structures, which are the precursors to the female reproductive organs.
Right.
Ultrasound can also help us locate the gonads, especially if they weren't palpable during the physical exam.
So ultrasound is like our window into the internal anatomy.
Exactly.
Okay.
And if the ultrasound doesn't give us enough information, we might consider other imaging techniques like an MRI or even a laparoscopy, which involves inserting a small camera into the abdomen.
Right. So we've got all these tools at our disposal to help us visualize what's going on inside the body.
That's right.
And sometimes they might also use a technique called genitography,
Yeah.
which involves injecting dye into the urinary tract.
Yes.
And that helps to see how it's structured.
Exactly.
So we're really building this comprehensive picture.
Yeah.
Looking at both the external and internal anatomy.
We're gathering all the pieces of the puzzle to get as much information as possible.
Okay, we've covered a lot of ground here. The clinical presentation, the hormonal clues, the imaging findings.
Right.
I have a feeling there's still more to this diagnostic journey, though, right?
You're absolutely right.
Okay.
We've got one more crucial piece of the puzzle to talk about.
What's that?
Genetic analysis.
Ah, the DNA detective work.
Exactly. Genetic testing is often essential for confirming a diagnosis of 46XY-DSD. It's like analyzing the source code, the very instructions that guide development.
Right.
And just like with the other diagnostic steps, the choice of which genetic tests to do depends on a bunch of factors, like family history, clinical presentation, and the findings from the hormonal evaluation.
Okay.
It's a personalized approach to uncovering the genetic underpinnings of the condition.
So let's say we suspect testicular dysgenesis based on low AMH levels.
Okay.
What kind of genetic testing might be done?
Well, in that case, we might start with a technique called SNP array, or ACGH.
Okay.
It's basically a way to look for missing or extra pieces of DNA, which can clue us into certain conditions.
And what if we suspect a specific condition, like PAIs or 5IR2D, based on the hormone profile?
Then we might do something called Sanger sequencing of specific genes, like the SRD5A2 gene for 5R2D or the AR gene for PAIs.
Okay.
It's a more targeted approach based on what we already know.
And what about next-generation sequencing, or NGS?
NGS is a powerful tool that can analyze multiple genes simultaneously.
Okay.
It's especially helpful when we suspect smaller genetic changes might be involved, like single nucleotide variations or small insertions or deletions.
Okay.
Think of it like casting a wider net to catch those elusive genetic culprits.
So we've got all these different techniques at our disposal, from looking at big chunks of DNA to zooming in on specific genes.
Exactly.
But the paper emphasized that even with all these advanced genetic tests, a negative or inconclusive result doesn't completely rule out a genetic cause.
That's an important point. There's still so much we don't know about the genes involved in sexual development.
Right.
And sometimes it might not be just one gene causing the DSD.
Okay.
It could be a combination of variations in multiple genes, what we call oligogenic or polygenic inheritance.
So it's not always a simple one-to-one relationship between a gene and a condition.
It's not.
Sometimes it's way more complicated.
Exactly. It's like a complex recipe with multiple ingredients interacting to create the final dish.
Right.
And as we learn more about the intricate world of genetics, we're getting better at understanding these complex interactions.
So to sum up, diagnosing 46XY-DSD is like a multi-step process.
It is.
Like piecing together a puzzle.
Yeah.
We start with a thorough history and physical exam.
Right.
Then we delve into the hormonal clues. get a glimpse of the internal anatomy with imaging.
Yeah.
And finally, we analyze the genetic code.
Yep.
Wow, it's truly fascinating how all these different pieces of information have to come together
Absolutely.
to make this diagnosis.
It highlights just how much goes into understanding these complex conditions.
Yeah.
It's a reminder that diagnosis is a process, a journey of gathering clues and making connections.
And it sounds like a journey that requires a whole team of experts working together
You're absolutely right.
to be able to do it.
It takes a multidisciplinary approach with specialists like endocrinologists, urologists, geneticists, and others, all contributing their expertise.
Well, we've covered a lot of ground in this first part of our deep dive into 46XY-DSD,
We have.
but we're just getting started.
Right.
We still need to talk about what happens after diagnosis.
Yeah,
How do we manage 46XY-DSD throughout a person's life?
that's a great question.
What are the ethical considerations?
Good one.
And what are the lived experiences of people with DSD?
Yeah, those are all great questions.
Yeah.
And we'll be tackling them in the next 2 parts of our deep dive, so stay tuned.
I'm excited to hear more.
Welcome back to our deep dive into 46XY-DSD. In part 1, we explored the intricate process of diagnosing this complex condition.
Right.
From taking a detailed medical history
Right.
and conducting a thorough physical exam
Yep.
to unraveling the hormonal clues
Uh-huh.
and deciphering the genetic code.
It's a lot.
It is. But now, armed with all of this diagnostic knowledge,
Right.
let's shift our focus to managing 46XY-DSD
Okay.
across the lifespan.
Yeah, I'm ready to dive into that.
Good.
It's like we finally put together the puzzle,
Yeah,
but now we have to figure out what the picture means. What do we
Well-
do with this information?
exactly. And managing DSD can be even more challenging than diagnosis
Okay.
because it involves so many different factors: medical, ethical, psychosocial.
Right.
There's no one-size-fits-all
Yeah.
approach. Every individual is unique, and decisions need to be made on a case-by-case basis.
Right, taking into account that person's specific circumstances.
Exactly.
So where do we even begin with managing 46XY-DSD?
Yeah, that's a great question.
I know the research paper didn't go into a ton of detail on this,
It didn't.
but it did highlight some key points.
Right. One of the first things to consider is the sex of rearing.
Okay.
This decision is often made in early infancy,
Right.
and it's based on a lot of factors, including how severe the DSD is, the potential for future fertility,
Mm-hmm.
and what we think the psychosocial outcomes might be.
I imagine that's a huge responsibility, like making that decision for a baby.
It is.
And there's a lot of conversations happening between, the medical team and the family.
Absolutely. Open communication is crucial.
Hmm.
And it's important to remember that sex assignment at birth isn't always set in stone.
Okay.
As individuals grow and develop, they might identify with a gender that's different from the one they were assigned.
Right.
So respecting their autonomy and providing ongoing support throughout their journey is paramount.
The paper also touched upon the potential need for gonadectomy.
Yeah.
And I can see how that would be a difficult decision for families to make.
You're right. Gonadectomy, which means surgically removing the gonads, either the testes or the ovaries, is a complex decision.
Right.
It's often driven by the risk of gonadal malignancy.
So cancer.
Yes. Certain types of DSD, particularly those affecting how the gonads develop,
Okay.
can increase the likelihood of developing tumors
Right.
in those gonads.
So it's a balance between mitigating that cancer risk
Yeah,
and preserving the potential for future fertility.
absolutely.
That's going to be a tough call to make.
It is. And if gonadectomy is performed, hormone replacement therapy might be necessary to ensure the individual goes through puberty
Okay.
and to maintain their bone health.
So we've got these big decisions about sex of rearing and the potential for gonadectomy. But what about the day-to-day management of 46XY-DSD? What kind of ongoing care do these individuals need?
Well, that really depends on the specific cause of the DSD.
Okay.
Some individuals might need regular monitoring of their hormone levels,
Yep.
kidney function, or other health parameters. It's about tailoring the care to each person's needs.
So again, it sounds like it takes a whole team of specialists
It does.
to do this.
The paper emphasized the importance of a multidisciplinary approach,
Okay.
which means involving a team of specialists, including endocrinologists,
Right.
urologists, geneticists, psychologists, social workers.
Wow, it's a big team.
It is. Managing DSD isn't just about addressing the physical aspects.
Right.
It's about providing holistic care that encompasses the emotional, social, and psychological well-being
Of course.
of the individual and their family.
It sounds like open communication is really key throughout this whole process.
Absolutely.
Not just between the medical team and the family,
Right.
but also with the individual themselves as they get older.
Yes. Providing accurate and age-appropriate information is crucial for empowering individuals to understand their bodies,
Right.
to make informed decisions about their health,
Yeah.
and feel comfortable talking about their experiences.
And it helps to reduce stigma.
Absolutely.
So managing DSD isn't just about medical interventions. It's also about creating this supportive and inclusive environment
It is.
where these individuals can thrive.
Precisely. It's about challenging societal norms and expectations surrounding sex and gender,
Right.
and promoting acceptance and understanding.
Now, this research paper focused mainly on diagnosis.
It did.
It didn't really go into a lot of depth about the specifics of managing different types of 46XY DSD.
You're right. And this is where it's important to remember that every case is different.
Right.
We can't make generalizations based on one research paper.
Right.
There's a lot of ongoing research and open dialogue happening in the field to better understand how to manage these conditions effectively.
So if we were to dive deeper into the management of specific types of 46XY DSD,
Yeah.
what are some of the key areas we'd explore?
Well, let's take androgen insensitivity syndrome, or AIS, as an example.
Okay.
AIS is one of the more common causes of 46XY DSD. Individuals with AIS have XY chromosomes, but their bodies are resistant to androgens, like testosterone.
Okay.
This means they might have female, typical external genitalia, but internally they have tests instead of ovaries.
So their outward appearance might not match their genetic makeup.
Exactly.
That must create a lot of unique challenges.
Absolutely. Managing AIS involves a lot of careful consideration. Decisions need to be made about things like genitography,
Right.
hormone replacement therapy, and how to address potential fertility issues.
Right.
And of course, providing psychological support is essential,
Yeah.
especially as individuals navigate their gender identity and how they fit into a world that often assumes a binary understanding of sex and gender.
It sounds like a very personalized approach is essential.
It absolutely is.
Yeah.
And the same goes for other types of 46XY DSD, like reductase deficiency,
Okay.
which is another condition that affects how the body processes testosterone.
Right.
Each type of DSD has its own unique considerations, and management strategies need to be tailored to the individual.
So beyond the medical aspects, what are some of the broader challenges
Yeah.
that individuals with 46XY DSD might face?
One of the biggest challenges is navigating a world that often doesn't understand or recognize their experiences.
Okay.
There's a lot of stigma surrounding DSD.
Yeah.
Individuals might face discrimination, prejudice, and even violence.
It's heartbreaking to think about all the challenges people with DSD face, just because of who they are.
It is.
Yeah.
And it's why raising awareness and promoting education about DSD is so important.
For sure.
The more we understand about these conditions,
Yeah.
the better equipped we are to challenge stigma and create a more inclusive society.
Okay, so we've talked about the importance of a multidisciplinary approach to care, open communication,
Yeah.
and addressing both the medical and psychosocial aspects of managing 46XY DSD.
Right.
What about the ethical considerations? This seems like an area where there are a lot of gray areas.
You're right. Ethical considerations are woven throughout every aspect of managing DSD.
Okay.
One of the biggest areas of debate is around decision-making authority.
Yeah.
Who gets to decide the sex of rearing for an infant?
Right.
How do we balance the rights of the parents
Yeah.
with the best interests of the child?
Right.
These are complex questions with no easy answers.
And as individuals with DSD get older,
Yeah.
how do we ensure that that they have the autonomy
Right.
to make their own choices
Yeah.
about their bodies and their identities?
Exactly. Respecting their right to self-determination and providing them with the information and support they need to make choices that align with their values and goals is crucial.
And what about the long-term consequences of some of these medical interventions?
That's another important ethical consideration. For example, with gonadectomy, we need to think about the potential psychological and social impacts of removing the gonads. We need to make sure that individuals who undergo this procedure receive appropriate hormone replacement therapy and ongoing support.
Right.
It's not just about addressing the immediate medical concerns,
Yeah.
but also considering the potential long-term effects on their overall well-being.
So managing 46XY DSD is about so much more than just the medical aspects.
Absolutely.
It's about respecting individual autonomy, promoting understanding and acceptance, and creating a supportive environment where people can thrive.
That's a great way to sum it up.
Yeah.
It's a reminder that this is a field that's constantly evolving
Right.
as we learn more about these complex conditions and how best to support individuals and families.
And speaking of evolving, the language surrounding DSD is also changing, right?
It is.
The term disorders of sex development has, it's been met with some pushback.
You're right. Some people find the term disorders to be stigmatizing,
Okay.
as if there's something inherently wrong or broken about them.
Right. So what are some of the alternative terms that people are using?
Some people prefer differences of sex development
Okay.
or variations of sex characteristics
Okay.
to emphasize that these conditions are part of the natural spectrum of human diversity.
I can see how those terms just feel more affirming,
Yeah.
less pathologizing.
Exactly. And it's important to be sensitive to the language that people prefer,
Right.
to avoid using terms that can be hurtful or inaccurate.
Like, for example, intersex or hermaphrodite
Right.
or ambiguous genitalia.
Yeah, those terms can be problematic.
Those feel very outdated and clinical.
Exactly.
Yeah.
It's about using respectful and accurate language
Right.
that reflects the individual's preferred terminology
Uh-huh.
and avoids perpetuating harmful stereotypes.
Okay, so we've talked about the evolving language surrounding DSD.
Yeah.
Now let's zoom out a bit and consider the broader societal implications
Oh,
of
God.
46XY DSD. This isn't just about medical knowledge. It's about challenging our society's deeply ingrained assumptions about sex and gender.
Absolutely. Our society often operates on this binary system of sex and gender,
Okay.
assuming that everyone fits neatly into the categories of male or female.
Right.
But DSD challenges that binary.
It does.
It shows us that the complexities and the fluidity of human development.
It forces us to confront the limitations of our language. Our social structures, and our expectations about what it means to be male or female.
Exactly. And that can be uncomfortable for some people because it disrupts long-held beliefs and challenges the status quo.
Right.
But it's a necessary disruption.
I agree.
DSD shows us that nature doesn't always conform to our neat and tidy categories.
Right.
Human diversity is something to celebrate,
Absolutely.
not fear.
It's about expanding our understanding of what's possible
Yes.
and creating a more inclusive society
Right.
that embraces the full spectrum of human variation.
Precisely. DSD is an opportunity to rethink our assumptions,
Yeah.
challenge our biases, and create a world where everyone feels seen, valued, and respected.
So we've covered a lot of ground in this second part of our deep dive.
Yeah.
From the practical aspects of managing 46XY-DSD
Right.
to the ethical considerations and the broader societal implications.
Mhm.
But there's one crucial piece that's missing.
What's that?
The voices of people who are actually living with DSD.
Yeah.
Their stories and their experiences are essential
Absolutely.
for truly understanding this complex condition.
You're absolutely right. In the next part of our deep dive, we're going to step aside and let those voices take center stage.
Okay.
We'll hear their stories, their challenges, their triumphs, and their perspectives on living in a world that doesn't always understand or accept them.
I'm looking forward to that.
It's through listening to and learning from their experiences that we can truly move towards creating a more inclusive and supportive world for everyone.
Welcome back to the final part of our deep dive into 46XY-DSD.
Yeah.
We've explored the science,
We have.
the medical considerations, the ethics.
Right.
We even talked about the language surrounding this condition.
Yeah.
But now,
Yeah.
now it's time to shift our focus
Okay.
to, I think, the most important part of this whole conversation.
Right.
The human side of 46XY-DSD.
Absolutely. You know, we've talked about chromosomes, hormones, medical procedures,
Mm-hmm.
but ultimately it's the lived experiences of individuals with 46XY-DSD that really bring this topic to life.
Yeah, for sure.
Their stories are powerful reminders that behind all the medical terms and scientific data
Right.
are real people navigating complex emotions,
Yeah.
societal pressures,
Yeah.
the ongoing process of self-discovery.
Yeah. So for this final part, we're going to step back
Okay.
and let those voices take center stage.
Yeah, I like it.
We're going to be sharing excerpts from interviews and personal accounts of individuals with 46XY-DSD. really allowing their experiences to illuminate what it's really like to live with this often misunderstood condition.
Each story is unique, reflecting that diverse range of experiences within the DSD community.
Right.
But there are also some common themes that weave through these narratives. Themes of resilience, self-discovery, and the search for belonging.
Yeah, one theme that keeps coming up is this challenge of navigating a world that often assumes this binary understanding of sex and gender.
Right.
A lot of individuals with 46 XY-DSD have faced pressure to conform to these societal expectations,
Right.
sometimes undergoing medical interventions that they later came to regret.
Yeah, and I think this quote from Alex, who was assigned female at birth but later identified as male, really captures that struggle.
Okay, let's hear it.
He says, "Growing up, I always felt different. I didn't fit in with the girls, but I didn't feel like a boy either. I was told I had a medical condition that made me this way, but I never really understood what it meant. It wasn't until I was in my teens that I started to learn about DSD and connect with other people who had similar experiences. That's when I finally started to feel like I wasn't alone."
Hearing Alex's story, it really highlights how important it is to provide accurate information and support to individuals with DSD from a young age.
Absolutely.
Like, it's about empowering them to understand their bodies and make informed decisions.
Yes.
And really embrace their unique identities.
Yeah, and it's not just about providing information.
Right.
It's also about creating a space
Yeah.
where they feel safe and supported to explore their identity without judgment.
Right. And another powerful theme that emerges from these narratives is the importance of finding community.
Yeah.
Finding connection.
Yes.
Many individuals with 46 XY-DSD describe feeling isolated and alone. Yeah. Often struggling to find others who really understand what they've been through.
Yeah, it can be incredibly isolating to feel like you're the only one going through something.
Right.
Here's a quote from Chloe, who identifies as intersex.
Okay.
"For years, I felt like I was the only one in the world who had gone through what I had. I was afraid to talk about it, afraid of being judged or rejected, but then I found an online support group for people with DSD, and it changed my life. I finally had a space where I could be myself, share my story, and connect with others who understood."
Wow. Finding a community where you feel seen and understood can really make all the difference.
Absolutely.
It's a reminder that we all need connection. We all need belonging, especially when we're navigating something as personal and complex as DSD.
These stories really underscore the need for more visibility
Uh-huh.
and awareness about DSD.
Yeah.
The more we talk about these conditions,
Right.
the less isolated individuals will feel.
And it's not just about creating spaces for people with DSD to connect with each other.
Right. It's about fostering understanding and acceptance in society as a whole.
Absolutely. We need to move beyond the fear and stigma that often surround DSD.
Right.
Recognize the diversity of human experience.
Now, while these personal accounts are incredibly valuable,
Yeah.
it's important to remember that they represent individual experiences.
You do.
We can't generalize about the entire DSD community
Yeah.
based on, just these few stories.
That's a crucial point. The DSD community is incredibly diverse.
Yeah.
Each person's journey is unique. We need to be careful not to homogenize their experiences.
But what these stories do offer is a powerful glimpse into the human impact of 46 XY-DSD.
For sure.
They remind us that behind all the medical diagnoses and treatment protocols
Yeah.
are real people with hopes and dreams, fears and aspirations.
And they challenge us to move beyond the clinical understanding of DSD.
Right.
Embrace that full spectrum of human experiences. So, as we wrap up this deep dive into 46 XY-DSD, we want to leave you with a few key takeaways.
Okay.
First, DSD is more common than many people realize.
It is.
It's a natural variation in human development that deserves to be understood, accepted, and celebrated.
Absolutely.
Second, accurate information and support are crucial for empowering individuals with DSD to make informed decisions about their health, their bodies, their identities.
Couldn't agree more.
Third, creating inclusive spaces where individuals with DSD can connect, share their stories, and find support is essential for fostering a sense of belonging.
Yes.
Reducing stigma.
Absolutely.
And finally, let's all commit to using respectful and accurate language when we're discussing DSD, avoiding those terms that can be hurtful or perpetuate harmful stereotypes.
So important.
We hope this deep dive has given you a deeper understanding of this complex and often misunderstood condition.
I hope so too.
We encourage you to continue learning, engaging in these conversations, and advocating for a world where all individuals, regardless of their sex or gender, feel seen, valued, and respected.
Well said. Thanks for joining us on this journey of discovery.
It's been great having you.